Hi everyone, my name is Angi Chasensky and I am the ROSC Project Coordinator.
I'm Dan Sokulski. I'm a Recovery Support Specialist assigned to the ROSC.
The ROSC is a paradigm and it's an acronym for Recovery-Oriented Systems of Care, because historically people would come out of treatment for substance use disorder or basically addiction to alcohol, drugs, any other kind of substances, or any kind of behavioral health. That could be gambling, eating disorders, anxiety, depression, some mental health in there as well. Basically overall coming out of treatment, and then they're thrust right back into their environment. So there's environmental triggers, maybe family members don't exactly understand their recovery path that they're now on. So what the ROSC looks at is bridging community supports for people coming out of the treatment centers and coming back into their communities and their environments, because we understand that recovery does happen in the community. So not only do we need to bring different community members together, like agencies, employers, family, friends, educators, we need to bring them all to the table with people with lived experience, and that's people in recovery. Everyone coming to the table to talk, not only talking about what they need, people in recovery in their community, but how do we bring it to them? How do we all come together and collaborate on what is needed, the deficits in the community, to help people stay on their recovery path? So what the ROSC does is look at bridging those community supports. So bringing all those players to the table, but then also bringing those community sectors and anyone else that could be possibly involved with someone's recovery journey. So the state of Illinois understood this concept and this paradigm, and they launched their first cohort of ROSC consuls back in 2018. And what a cohort is different ROSC consuls sprinkled throughout the state of Illinois. So in the state of Illinois, there's about 8 or 9 ROSC consuls that were launched in 2018. They stem anywhere from like Chicagoland area to the eastern states, western states, southern, and then here in central Illinois, we have McLean County ROSC Council. And what we're trying to do is bridge those community supports for, again, people coming out of treatment and pursuing their chosen recovery path, because we do know that recovery does happen in the community.
ROSC is not a treatment program. It's not a recovery program like AA or Celebrate Recovery or anything along those lines. Like Angie said, kind of a paradigm, a shift in how we look at and approach recovery. In the past, people would go to treatment, as she mentioned, typically in a heightened state of crisis following maybe a DUI or an overdose or a family intervention. By choice or by force, they go to a treatment center for a residential stay or outpatient stay, and we'll say it was a 28 days is kind of the typical amount of time. And then they're referred to either aftercare or, support meetings, but not really given much else along the lines of recovery support. With the ROSC, we try to look at recovery a little bit more pragmatically and holistically. So it's not just that recovery is treatment and meetings. That's really anybody who's worked a recovery program knows there's a lot more involved. And then there's also a lot more risk to sobriety, particularly in that first year or so, early recovery. And so what the ROSC does is look at those different stumbling block areas. A lot of the big areas that we're looking at are sober living, making sure people have a safe place to go, where there's not using, transportation, employment, recreation to combat boredom in early recovery. And there's a lot of other areas that we'll talk about in future videos.
And Dan, you brought up a very good point about some of the different efforts that are going on, like the sober recreation and focusing on like activities, living arrangements, things along those lines. That's what we're trying to do, is bridging those supports. Because if we get people talking and acting on those initiatives, then ideally we'd like to develop a recovery community organization, or an RCO. So that is really the big vision of the ROSC Council itself throughout not only McLean County, but the state of Illinois. So we need to start tackling these initiatives, like Dan said, sober living, sober recreation, spirituality. There's multiple pathways to all these different items that keep someone's recovery path in check for themselves and how they define it.
And when we talk about recovery happening in the community, a lot of times what you hear in regards to people coming out of treatment or even jail or just entering a recovery lifestyle is the recovery community. And that refers to a lot of times 12-step programs, some people that basically live and breathe recovery, but it's oftentimes left to that recovery community, which is just a small subset of McLean County, the community at large, to sort of shoulder the burden of helping, newcomers find work, helping them find a place to live, helping them, with events and activities to kind of keep them busy, sponsorship, those types of things. By involving the community at large, which is a huge mission of the ROSC, what we're trying to do there is reduce stigma and also educate and make people at large aware, how and why addiction is a disease. And if we can get them to understand that, then some of the stigma associated with addicts, alcoholics, might be reduced. And if people can overcome that stigma and realize they're not, that we're not bad people, we're not, people out to cause harm or hurt society, we're just sick people, then they might be a little bit more inclined to get involved, come up with resources, time, money, whatever it might be, to get help some of these projects off the ground. And so that's a big reason why the ROSC needs to happen in the community.
Great. So if you want to get involved, please subscribe to our channel and stay tuned for some of the events and activities that we have going on right now and soon to be coming up on the horizon.
Thank you.